There we are. Okay, we're live. I think a lot of people just saw my funny face there because it didn't say we were live until about 6 seconds into it. So there we go. All right. What's up, everybody? Welcome to another Lunchtime Live with both myself, Daniel Tribby, and our lovely physician, Dr. C, or PC, as I yell at you for. We are the co-owners of Regenerative Sports Spine and Spa in the greater Orlando area. We do this every week to bring you guys some information on stem cell therapy and natural healing for your bone, muscle, joint, and spine issues, as well as some other kind of creative things that we do in our office. I hope everybody had a great Labor Day weekend. Doc, how are you today?
I'm doing all right. Had a nice, relaxing Labor Day weekend.
Good. So today we're going to talk about more shoulder stuff, right? September, these talks are all about shoulder stuff, okay? Last week we went into the rotator cuff and did a discussion about why rotator cuff tears don't always require surgery, and how you can take advantage of your body's own stem cells to help heal your rotator cuff. This week we're going to touch on a different angle of shoulder injury that I've had 2 surgeries on myself. So many years ago, before stem cell therapy was a thing. So I've had 2 shoulder surgeries for cartilage tears inside of my shoulder. So I'll tell you a little bit more about that in a minute. If you're just joining us, please stick around, and we're going to talk about shoulder injuries and stem cell therapy. If you have questions or comments, please drop them in there, okay? So Doc, give us a little bit of background on this ball and socket joint that is the shoulder, and what are some of the major cartilage areas there, and what typically gets injured with those?
Ooh, I actually have a model today. How about that?
Hey.
So we have lots of injuries. It's like this is the rotator cuff that comes in and attaches, and then imagine underneath, right on the bone, there's cartilage, which is also called labrum in the shoulder, as well as underneath here in this little cuff area. And so really, it's like we're talking about possible cartilage injuries, right? So that's kind of what that looks like. So there's a lot of you can see that there's not a lot of stability in this. That's why the rotator cuff is very important in the stability and function of the shoulder joint. Whereas in the knee, you just go forward and backwards, essentially. There's not a lot of lateral movement. This is movement in all directions, essentially. Yeah. So that's why it has a lot of injuries typically, and is a little bit more fragile than the knee, I'd say.
Yeah, absolutely. The shoulder has a significant higher rate of injury than the other joint in the body. And it's because it is the most free moving joint in the body, right? It has the most play. And this allows different stresses to enter into ball as it fits in socket. So the socket has a cartilage lining called the labrum, and the ball has a cartilage lining. And some of you may have suffered things like slap tears or Hill-Sachs or reverse Hill-Sachs lesions if you're me, because I don't do anything in the 90th percentile. I'm the 10 percentile guy who just does the weird stuff. But those are all just fancy terms that talk about tears to the cartilage surfaces there. A lot of baseball players suffer slap tears, right? And if you're watching this, you may yourself have had what's called a slap tear. So the slap tear is actually a tear in the upper part of the labrum. It runs from the front to the back, comes all the way across the top. So you imagine the top of your shoulder here where the ball fits into the socket. Inside the socket there, you have a tear across that top part of the labrum. It a lot of times causes clicking and catching and discomfort, particularly with anything up and over and behind your head. And then occasionally behind the back as well. Reaching across the body can be an issue, but it's an area that's typically surgically repaired, right?
Yep. So, well, typically in the past, yeah.
Right. So why, or can you talk about the surgery and what is actually done there? Like how do they actually fix a torn labrum?
Well, there's a couple of options that they usually work with. And one is basically sewing up the cartilage if it's possible to do that. Because sometimes, when you have the cartilage tear, it flips up and down. And that's where a lot of the clicking comes from. So you can basically what they do is tie it down so that it's not flipping all around. And so sometimes that helps. And then the only other way that they go in and do repairs is actually to shave the cartilage down, which
remove it.
Unfortunately, it's not the best option because it actually promotes more arthritic changes as time goes on. Mm-hmm. And you have more wear and tear in the cartilage. And so it can cause significant problems in your future if that's what they end up doing and during the surgery. So,
right. And a lot of times these cartilage injuries happen from things like dislocations, right? And so we see a lot of people, that's where this ball slips through and tears that. And then you talked about sewing it down. So the process, so you guys understand this, is they take what's called an anchor and they screw or hammer the anchor into the bone. And then that has sutures or stitches attached to it. And they use that to then weave through your cartilage and recreate that bumper or that cartilage surface there. And then if you have actual damage to the ball, the cartilage surface there, how do they fix that? This is even more exciting.
To the actual ball, honestly, it's like I'm not a surgeon, so I don't really know how they do that.
So let's talk about how they fix that. I'm not a surgeon either, but I've had it done. So they do what's called a microfracture. So
yeah. So
bleeding,
to heal the bone, yeah.
Right. So bleeding causes a signal for healing, right? This is one of the main characteristics of what we do inside of stem cell therapy is, we want inflammation, we want blood flow, we want to encourage this stuff to come to your area of desired healing because it's what signals healing for these surfaces. So the cartilage doesn't have a very good blood supply. This is why it won't heal on its own. So this ball, if you get any sort of damage to it, what they will do is clear away the bad tissue, and then they will actually cause microfractures. They will actually go in and break the bone ever so slightly in small little spaces so that it causes bleeding, and then the natural healing process helps recreate some of that cartilage. Sounds amazing, right?
Yeah.
Yeah. So I've had that done. That was done to the ball of my left shoulder. I have had the labrum, or the cup inside the shoulder, fixed twice, same arm. And I can tell you, if I could go back in time, I would definitely not have that surgery. My last surgery was how many years ago? 2009, right? So what is that, 12 years now? Mm-hmm. So before then, this is what we did. We did injections, we did physical therapy, we had surgery, and these surgeries take 9 months usually to get back to 100%, especially if you're an active person, right? If you're a sport specific guy, or you're a golfer, or you enjoy, being really active, this is a long process for you to be out of that activity. It affects your sleep. It does all sorts of things that are just, you can't wipe your butt. You can't take a shower. Like there's all kinds of things that are limited in life when you have to have these surgeries. But that's why we're here. We have this new ability to promote healing of those surfaces through a more natural way. So let's talk about that, Doc.
Just a quick back question for you, though. How long were you in that brace that holds your arm out in 45 degrees?
The first time or the second time?
Second time.
Second time wasn't as significant. So the first surgery was really bad. I was in it for 8 or 9 weeks. Second one, I think 6.
Okay, yeah, that's what I thought. So it's like just imagine you're running around with your arm like this. You can't really do a whole lot. And then after that, then you need to get into therapy to fix the stiffness and all of the everything else that, immobility does for you. So that's why it takes 8 or 9 months, or in some people longer, to get better after this type of surgery. So it's a big deal. So there's something not to take lightly. So like as Daniel was saying, now we have an alternate option, which is stem cell therapy, when that's typically from the bone marrow or the fat. And so that we can actually get in and inject the cartilage and then help with some of that repair. It's like it's not going to necessarily repair it fully, but studies have shown that it can help with some of it and then help promote some of the recovery much better than anything else. And you don't have the same amount of downtime. It's like you still will probably have to be definitely downtime a couple of weeks without doing a whole lot. But after that, we slowly start getting you back into therapy already. And then typically people get back to their full activities much sooner, within a couple of months. Mm-hmm. So, which is a significant difference, right? So a couple months versus 9 to 12. So, yeah.
Absolutely. And your healing process continues, right? As we inject those materials there that are from your own body, your healing process will continue for a long period of time. Most people don't realize that just to be healed after a surgery is at least 100 days. The research will tell you it's at least 100 days. So think about a whole quarter of your life is dedicated just to healing. Your rehab process usually will go 6 months to a year, depending on how significant. The problem was my first surgery, easily 9 months before I felt any sort of normalcy in that shoulder. Second one, about 6, a little better. So, but it does take a long time to heal from these surgical interventions versus using something more natural that your body can use on its own to repair, right? So we mentioned earlier that bleeding signals healing, right? So when we use stem cell therapy or regenerative medicine, how does that do the same thing?
Well, basically what I would do for this particular injury is actually inject into the cartilage and then inject directly onto the bone. So you're doing this, it's like similar. You're causing some micro trauma in order to stimulate the bleeding, but also putting cells that have those blank cells that can become what you need them to be a lot of the time and help with some of that repair. And that's why it causes inflammation as well. So definitely expect some inflammation for a few days because that's the process of the healing that we're trying to promote with doing procedures, right? So
yeah, and I'm glad you mentioned the inflammation part because usually after a surgery, you get a bottle of pills. One is usually pain, and the other one is usually an anti-inflammatory.
Right.
So pain medicine obviously does wonders for your gut as well as the potential addiction issue and all that. But aside of not going down a rabbit hole of why pain medicine is so bad, but let's talk about why taking inflammatory medication can actually work against you in this particular instance.
Well, I mean, because inflammation is your body's natural response to try and get that area better, and it brings those properties like growth factors and things like that into the area. And so, if you're actually taking the anti-inflammatories, it reduces that healing property that your body's trying to actually promote. Mm-hmm. So, something to think about.
And all these people who continue to use ice after injuries and surgeries, who continue to take ibuprofen or whatever it may be to help, you're actually delaying your healing process. You're actually preventing your body from moving through the natural phases of healing, all right, which you need the inflammatory phase. So you're just prolonging your inflammatory phase so that you can control pain. And there's other ways to control pain, right?
Right.
When we do these stem cell injections, we actually inform people to not use anti-inflammatories, right? Or to not use ice and to,
correct.
I mean, for lack of a better word, suck it up for a little bit because you need your body to heal, right? You need the inflammatory response to recruit as much healing factor to that area, right?
Correct. Yeah. So, I mean, we don't, it's like tell you to suck it up. We try to give you other medications.
I make jokes.
Yeah, not anti-inflammatories, but yes. So we actually recommend you use heat to help with it. So that's one of the things is you definitely should not be using anti-inflammatories for a while after the procedure because we want that inflammation to help with the repair.
Sure. So from a stem cell perspective, can you just talk, I mean, we talk about stem cells a lot, but can you talk about their importance to the body and what they actually, what they do and why it takes an actual procedure to get them to do what they're supposed to do? Like, why don't I have an injury and my stem cells automatically go, let me go fix your cartilage tear?
Well, it does. You have the injury, and then that's what your body does to help try and repair is like it takes all those growth factors and stem cells from you and then go to that area to try and help heal. However, after a certain amount of weeks, it goes dormant again. So those cells that are the healing generators, they go back dormant, and typically they live in your pelvic area, in your tibia, and your skull. And so you want to think of it like, troops. Like if you're basically waiting for the action, you're just kind of hanging out in one area. And then when there's, it's like a problem area, then you go to that area until the problem stabilizes, right? So it doesn't necessarily have to be fully better. It stabilizes enough, then you go back and wait for any, active injury again. So what we're doing is we're going into, we usually do it from the pelvis area. So I take the bone marrow out and then inject it into the area that you need it to. So we make them start. In addition to that, it's like by putting the cells there, we're also causing that microtrauma we talked about, creating essentially a new injury, which also stimulates the cells that are still in your body and more cells to come to the area and help with repair. So really, it's twofold benefit when we do it this way.
Got it. Very good. Awesome. So if you're out there living with shoulder injuries or know somebody who has, and you're interested in looking for a different way of healing, we're definitely going to, from a very biased standpoint, suggest you go through regenerative medicine. And it's not a Like, this is not something, just like a surgery doesn't always fix everything. This will not always fix everything. If your shoulder has just been totally trashed and damaged a bunch of times, you know, the likelihood of this helping, it may not be, you know, the thing for you. Surgery may be your only route. And we take pride in taking the time to look at all your images and your x-rays to make sure that this is something that actually works for you, right? We're not going to just go, yeah, it works for everybody, and just start taking bone marrow and sticking needles in places, right?
Right.
So if you are suffering from shoulder stuff, take it from somebody who's been there. Surgery is not always the way to go. Surgery does limit your activity for such a long period of time, and then you have such a long rehab process afterwards. Look into using your body's natural healing resources like stem cell therapy. And above all, make sure you're going to the proper what, doc?
Medical doctor.
That one. Stop letting people who don't have qualifications to use needles in orthopedic world stick you with a needle. Okay, these are not your PAs. These are not your nurse practitioners. Okay, you need qualified physicians, such as, this lady right here, to get the needle where it's supposed to be. Right, we want to make sure these injections go directly into the spot where the tear is, right, or into the cartilage where the damage is.
Yep, absolutely.
Okay, so how many of these? Go ahead and do a little bragging. How many of these injections have you done in your illustrious career?
Stem cell in general, or are we talking about joint and spine?
Just joint and spine.
Oh gosh, over 20 years, maybe at least over 20,000, I'd say.
So you have some qualifications to be able to do this the right way, right?
Yes, absolutely.
Cool. Love it. All right. Anything else for those people who are suffering from cartilaginous issues inside their shoulder?
Anything else? No, I think that's about it. Just do your research, make sure that you know what you're getting into, and find other options if possible. Awesome. It makes sense.
Yep, absolutely. And if you're in Greater Orlando area, we'd love to see you in our office or anywhere in Central Florida. We have people that have driven 2-3 hours just to come see us for our expertise. We would love to be able to help you get back to the life that you've been missing out on due to pain and injury. If you're outside of Florida, we definitely have a great package that gets you. All you got to do is get on a plane and get to us. We have a place to put you. We have a car and driver to get you back and forth, and somebody on call to help you during this process. So if that is you and you're tired of going through injections and pain medicines and rehab over and over and over again and another surgery, we definitely want to be able to help you get back to the life that you love and the one that you enjoy, and those weekend warrior activities that you want to take part in, or just the sleep that you've been missing on. So don't hesitate to take a look at this page, hit the contact us button, drop a comment, ask questions on this live. If you're watching it post, we will go back and answer them for you. So anything else there, PC?
That's it.
All right. Everybody has a great week. Stay safe, stay healthy, and we'll be back next week with some more shoulder stuff.
All right. Thanks, Daniel.
Yep.